Hello, my name is RJ Carrillo. This is Lindsay Liao, Taylor Burnett. We are students here at Texas Lutheran University. We are in the medical terminology course taught by Dr. Coulomb. And today we'll be talking about geriatric diseases and disorders.
So first, just some basic anatomy and physiology. The skeletal system, you'll see as you age, the joints have less synovial fluid, still osteoarthritis can occur. In the muscular system, you lose some muscle mass, so that would be muscular atrophy. In the nervous system, you'll start to get short-term memory loss that's going to begin to decline. In the cardiovascular system, your heart wall gets thinner. In the urinary system, you'll see incontinence, which is your inability to hold your feces or urine. In the immune system, the function begins to decline. You start to lose your leukocytes, lymphocytes. In your integumentary system, that'll change around your 40s. Your hair will become thinner and gray, and then your skin will become like paper thin. So we just have some pictures. As you can see here, this is what a normal knee would look like, and then this is a knee with osteoarthritis, which is just your skeletal system declining as you age. Here, this geriatric patient is using a cane or walking device. That is because she has most likely lost some muscle mass in her legs, so that would be muscular atrophy. And then here we can see your short-term memory is right here. That's just part of your nervous system. So your short-term memory will begin to decline before your long-term memory. And then just a few more pictures. Over here you can see the sphincter is open. That's because people that are older have incontinence, which is you can't hold your own urine. Here, this is a picture of the heart wall. This is what a normal heart wall looks like, but your cardiovascular system begins to decline, so your heart wall will get thinner. And then here you can see this person's skin is really wrinkly and it looks thin. That is part of your integumentary system.
And here we have dementia, which is an overall term for diseases characterized by decline of memory. We have Alzheimer's disease, most common form of dementia. We have a Lewy body, abnormal cell in the brain. This is also a form of dementia. Here we also included a picture of a Lewy body. Now we have Parkinson's disease, which is another cause of dementia. We have vascular dementia, which arises from strokes or bleeding into the brain. We have incontinence, inability to prevent discharge of urine or feces. We have instability, difficulty in balance. And lastly, we have sarcopenia, loss of muscle mass, which is also pictured here in the bottom right corner. We have our normal muscle mass and the atrophied muscle.
And then so here we're going to talk about Parkinson's disease. And so Parkinson's disease is just a form of dementia. Some symptoms include tremors, instability, incontinence, and stiffness. And here we have an image that's just broken up. You have your motor impairments, then you have your non-motor impairments. Some motor impairments include your postural imbalance, tremor, and muscular rigidity, and freezing of movements. Also, your non-motor impairments include sleeping disorders, mood disturbances, sweat and olfactory disorders, as well as pain. And then so we wanted to provide some images, and so these images are pictures of some walkers. As you may see, some of your geriatric patients that have instability, and so you may see a lot of your patients with these walkers, as well as we have provided a image of what it may look like of vascular dementia and the causes of what it would look like leading to the vascular dementia.
So we have geriatrics here, which is knowledge of medical treatment for old age. We have disease, which is apart from normal function. We have cognition, process of thinking. Cognitive, which is quality of thinking. Dementia, without mind.
And then picking back up, we have hallucination, which is just your imagination process. We have iatrogenic, which is pertaining to the production of medical treatment. We have incontinence, which, like RJ and Taylor said, is the inability to hold your feces and urine. And we also have visuospatial, which is just pertaining to your vision in space. And then here we have provided some examples of the negative effects of iatrogenic. And some negative effects would be some hair loss and hair thinning, as well as vomiting. And you can see many of these examples in chemotherapy and radiation.
And here we have COPD, which is chronic obstructive pulmonary disease, which is a leading cause of death in old age. We have AD, Alzheimer's disease, which is a slowly progressive dementia. We have DLB, dementia with Lewy bodies. We have FTLD, which is frontal temporal lobar degeneration.
And then continuing, we have RT, which is your reminiscence therapy. We have PDAs, which is your personal digital assistants. We have the SPECT, which is just your single photon emission computerized tomography, as well as PET, which is your positron emission tomography.
So here we just have some pictures. In the top, you can see this is a geriatric patient who has dementia, and they are getting therapy. This would be reminiscence therapy. They're looking at photos. Here we have COPD. As you can see, this is the normal alveoli, and then this is the damaged alveoli. And then on the bottom, this is a picture of a PET scan, which is, like we said, your positron emission tomography. And finally, this is appropriate to healthcare because as a medical professional, you need to know the common signs and symptoms that come along with old age and these diseases. Knowing these signs and symptoms can help a medical professional to diagnose and treat the patient, and this also makes it easier to explain the disorder or disease to their patient and their family.